This chapter will focus on autoimmune diseases as well as immunodeficiencies. As you've seen, our immune system does a pretty remarkable job at protecting us. However, it can also cause us harm. The damage can range from hay fever to dermatitis. Alterations in the immune system can also lead to asthma, anaphylaxis, diabetes, arthritis, and organ rejection. Immunopathology focuses on diseases caused by either over or under reactivity of the immune system. Hypersensitivity is a situation where our immune system is overreactive and can lead to allergies and autoimmunity. Healthy tissues are attacked by the immune system that can't recognize self from non-self. Hyposensitivity involves a weakened immune system with lower defenses. It's also known as immunodeficiency. Hyposensitivities can either be congenital, as in primary immunodeficiencies, or acquired in secondary immunodeficiencies. We will discuss these at the end of the chapter. Hypersensitivities involve overactivity of the immune system and include 4 types, which we will now discuss. Type 1 hypersensitivity involves basic allergies as well as anaphylaxis, with a response from IgE, mast cells, and basophils. Type 2 hypersensitivities involve IgG and IgM and cause reactions in blood transfusions and myasthenia gravis. Type 3 involves IgG and can lead to lupus, rheumatoid arthritis, and serum sickness. Type 4 hypersensitivity involves T cells and leads to dermatitis and graft rejections. Type 1 leads to allergies, which is an overactivity of the immune system with increased inflammation. An allergen is a substance that will stimulate an allergy. Atopy is a localized chronic allergy. Anaphylaxis is a severe situation where airways become obstructed and circulatory collapse. About half of the population suffers from allergies. The majority are mild and include asthma and food allergies. Some can be severe enough to cause death, and some allergies last a lifetime, while others can be outgrown. Some allergies are also acquired later in life. Generalized susceptibility is inherited, but not to a specific substance. For example, a parent who has allergies to ragweed could have a child who has allergies to cat hair. The genetic basis is an increased production of IgG along with increased activity of mast cells. If parents have an allergy, a child has a 25% chance of acquiring an allergy, and that chance increases if the siblings or grandparents also have allergies. The hygiene hypothesis basically states that we are too clean. We overuse antimicrobial substances and have clean environments. Our immune systems need to encounter microbes in order to be trained. Evidence has shown that kids who live on farms have lower rates of some allergies. C-sections and maternal history of allergies also increases the chance of a child developing allergies. Breastfeeding also decreases the risk of developing asthma and eczema. Cytokines, along with growth factors in the breast milk, help to induce tolerance to allergens in the gut. Roughly 600 types of bacteria can be transferred via breast milk. Allergens each have their own characteristics that will generate an immune system response. Proteins generate a stronger response than other substances. Some allergens are haptens that bind to carriers to become immunogenic. Household chemicals, cosmetics, food, and drugs can serve as haptens. How do the allergens enter? They can enter via the mucus of the digestive and respiratory systems. The allergens can also penetrate the skin through breaks, glands, and hair follicles. Inhalants include pollen, dust, dander, and fungal spores and are airborne. Ingestants are ingested and can cause food allergies. Injectants can come from drugs, vaccines, or venom. Contactants can enter the skin and are typically involved in type 4 hypersensitivities. Mast cells and basophils play a big role in type 1 hypersensitivities. These inflammatory cells can be found heavily in the lungs, skin, GI tract, and genitourinary tract. They each have up to 100,000 cell receptors that can bind IgE, and when it binds, cytokines are released. These cytokines induce an inflammatory response. The symptoms don't come directly from the allergen, but rather from the immune system cells. Histamine is released in large amounts and is fast-acting. It causes vasoconstriction in the respiratory and digestive tract, leading to difficulty breathing and increased intestinal motility. Bradykinin causes constriction of the bronchioles, increased diameter of the arterioles, increased capillary permeability, and increased secretion of mucus. Serotonin enhances the effects of the above two chemicals. Leukotriene is a slow, relaxing substance that causes contractions of smooth muscles. It can also lead to prolonged bronchospasm, along with permeability of blood vessels and mucus secretions. It can also stimulate leukocytes. Prostaglandins control contractions of smooth muscles and stimulate the contraction of the uterus during delivery. They also induce vasodilation and vascular permeability. We also see increased pain and bronchoconstrictions. NSAIDs decrease the activities of prostaglandins. Let's look at the cell reactions in an allergic response. In A, we see the sensitization stage, which is the first time we encounter an antigen. The allergen enters, and the B and T cells recognize it. Antibodies are then released, specifically IgE. IgE then binds to mast cells. Then, the next time the allergen is seen, the IgE binds the allergen, and the mast cells then release the allergic mediators. The prostaglandins then travel in the bloodstream and induce their effects like dilated blood vessels, pain, and constricted airways. Leukotrienes are also released and lead to the symptoms of asthma. Other chemical mediators are also released, perhaps leading to hives, vomiting, diarrhea, and increased mucus secretion. Hay fever also refers to rhinitis, which is caused by inhaled allergens that may be seasonal or chronic. Symptoms include congestion, sneezing, coughing, runny nose, and various others we've all probably experienced. Asthma involves labored breathing due to increased bronchoconstriction. The smallest amounts of allergens can induce a reaction in asthmatics. The symptoms may be difficulty breathing or severe constriction that leads to suffocation. Rattling can be heard as well. There's an excess reaction to leukotrienes and serotonin. Atopic dermatitis involves an inflammatory response that leads to itching. It could be caused by a variety of allergens. Most often it begins in infancy, and reddened lesions can be seen. In adults, dry, scaly, and thickened skin is seen. They can lead to increased susceptibility to bacterial infections. The majority of food allergies come from nuts, fish, milk, eggs, shellfish, and soybean, which enter through the intestine. The patient may experience multiple gastrointestinal issues. Hives, rhinitis, asthma, and anaphylaxis may also occur. Some reactions involve IgE and the release of allergic mediators from mast cells, while some don't. Individuals may experience reactions from vaccines made with egg products. Drugs can also serve as allergens, and allergies a common reaction. The individual may experience something as minor as a rash to fatal anaphylaxis. The drugs may include antibiotics, aspirin, opiates, and dyes used in x-rays. A hapten, or portion of the drug, serves as the allergen. Anaphylaxis can be a couple of different types. Cutaneous anaphylaxis is a localized reaction on the skin. Systemic anaphylaxis involves the respiratory and circulatory system and can be fatal in a matter of minutes. Bee stings and injections are the typical culprits. It is important to determine allergies and to identify the allergen. A blood test called a RAST measures the concentration of IgE in response to specific allergens. A trip test determines if a patient has experienced an allergic attack. High levels of basophils and eosinophils are also indicative of allergies. The leukocyte histamine release test determines the amount of histamine released in response to a specific allergen. Skin testing can also be used. The patient's skin is either injected, scratched, or pricked with an allergen. After 20 minutes, the skin is observed for a wheal and flare. The wheal is measured to determine the response. How can we treat and prevent allergies? Drugs can be taken to block the effects of our immune system cells and chemical mediators. Of course, another route could be to avoid the allergen, which is easier said than done in some situations. Desensitization involves a controlled exposure to the allergen in order to reset the response. Type 2 hypersensitivities involve lysis of cells due to the effects of IgG and IgM. This includes transfusion reactions and some autoimmunities. Alloantigens are molecules that differ between members of the same species, but can be recognized by the recipient. The immune system is functioning as it should by responding to foreign cells. The Rh factor is a monkey antigen that's present in 85% of humans and is a dominant gene. The only way we produce antibodies against Rh is through the placenta or blood transfusions. Hemolytic disease of the newborn may occur as a type 2 hypersensitivity. If a mother is Rh positive and the first child is Rh positive, some fetal red blood cells may leak into mom's circulation during childbirth. Nothing occurs with the first birth, but now mom begins production of the anti-Rh antibody. Should she become pregnant again with an Rh positive fetus, mom's antibodies cross the placenta and start to lyse the fetus's red blood cells, which can be fatal or cause anemia and jaundice. So how is this prevented? The blood types of the family will be needed. Should mom be Rh negative and the child is Rh positive, RhoGAM will be administered to prevent a reaction against the fetus's red blood cells. Type 3 hypersensitivities involve the reaction of antigens and antibodies and the depositing of them in tissues. It involves IgG and IgM along with complement. It also involves an immune complex reaction. A large concentration of antibodies are released, and then at the next exposure, the antigen-antibody complex are formed, and the complement system, as well as neutrophils, are recruited. As the complexes deposit, an inflammatory condition is seen. Arthus reaction and serum sickness are seen via passive immunization. They require sensitization and antibodies, much like an anaphylaxis. The difference is that it involves IgG, IgM, or IgA, rather than IgE in anaphylaxis. Type 3 hypersensitivities also require a large amount of antigens, and the symptoms may not be seen for hours to days. In A, we see the Arthus reaction, and B shows the serum sickness reaction. Type 4 hypersensitivities are also known as delayed reactions and involves T cells. The symptoms are typically seen 1 to several days after the second exposure to the antigen. tuberculin reaction is inflammation at the site of extract injection that appears 24 to 48 hours later. It's used to diagnose TB infections. It involves helper T cells releasing cytokines that recruit other immune system cells. Contact dermatitis is the most common delayed reaction. It's caused by exposure to poison ivy, poison oak, and haptens and drugs. There must be a sensitizing dose along with the reaction upon subsequent exposures. The dendritic cells process the allergen and display it to the T cells, which causes recruitment of lymphocytes and macrophages, which release enzymes and cytokines that damage the skin. T cells also can lead to rejections of organ and tissue grafts. MHC markers must be matched as closely as possible so that the recipient cells do not attack the organ. Siblings and parents share similar markers. If the molecules have a different MHC class, the T cells are likely going to react to them. Cytotoxic T cells recognize MHC1 and release interleukin-2. T cells bind to the tissue and start releasing lymphokines, which causes the reaction within 2 weeks. Antibodies are then produced, which damage the tissue's vascular supply and cause death of the graft. Sometimes the donor's tissue may contain lymphocytes that react against the recipient cells. The recipient may see systemic effects that are toxic. A skin rash is the most common symptom and can take up to 300 days for them to appear. In type 4 hypersensitivities, we may see a host versus graft response, where the immune system cells of the recipient mount a response against the transplanted tissue. In graft versus host, the opposite is seen. The transplanted tissue may have lymphocytes that react against the recipient cells. There are different types of grafts. An autograft comes from self, while an isograft comes from an identical twin. An allograft is the most common and comes from genetically different individuals of the same species. A xenograft comes from different species. Transplants have been performed on every major organ and come from live donors, deceased donors, or fetal tissue. Bone marrow transplants may be performed for individuals suffering from immunodeficiencies, anemia, leukemia, and cancers. The patient must also be treated with chemotherapy and radiation to prevent rejection. The patient's blood type may change to the donor's. Let's discuss autoimmune diseases where individuals have overreactive immune systems. They may produce T cells or antibodies against self. It may lead to a systemic or specific response. All but type 1 hypersensitivities involve an autoimmune disease. They include lupus, rheumatoid arthritis, Graves' disease, myasthenia gravis, type 1 diabetes, and MS. Susceptibility can be enhanced by genetics and gender. Cases may appear in families, and unaffected individuals may produce autoantibodies. Certain genes may lead to certain disorders due to specific markers. Sometimes antigens may resemble markers found on self cells, and the body may produce autoantibodies. Strep throat may lead to rheumatic fever and psoriasis flare-ups. Lupus is characterized by autoantibodies against organs, tissues, or intracellular substances. It's believed that viral infections and the lack of suppression of the immune system may be causes. Rheumatoid arthritis involves damage to the joints. Immune complexes form and settle in the synovial membranes, which lead to inflammation, scar tissue formation, and joint destruction. In A, we can see the characteristic rash associated with lupus, and B shows the effects of rheumatoid arthritis. Graves' disease involves antibodies to react against thyroxine-secreting follicle cells on our thyroid. This leads to an overproduction of thyroid hormones. Type 1 diabetes is believed to be caused by molecular mimicry. Cytotoxic T cells attack and rupture the insulin-producing beta cells, which leads to decreased insulin levels. In myasthenia gravis, autoantibodies bind to acetylcholine receptors, which is required for muscle contraction. It prevents acetylcholine from binding and can lead to complete loss of muscle function and death. Immunosuppressive drugs are administered to remove the self-reacting antibodies. MS involves the destruction of the myelin sheath that surrounds neurons. It alters the ability of the neurons to transmit impulses and leads to muscle weakness and ultimately paralysis. Human herpesvirus 6 is believed to be the causative agent. Immunosuppressants and interferons are used as therapeutics, but not treatment. Immunodeficiencies involve a weakened immune system that can be congenital or acquired after birth. Primary immunodeficiencies are ones individuals are born with. They include B-cell defects, whether it be low levels of B cells or antibodies. There could also be T-cell defects or severe combined immunodeficiency disease, which involves B and T-cell defects. Some immunodeficiencies are also caused by complement defects. Secondary immunodeficiencies may be acquired from natural causes like cancer, stress, pregnancy, or aging. They could also arise from burns, steroids, radiation, immunosuppressive drugs, or removal of the spleen. Primary immunodeficiencies can be inherited via mutations. Sometimes the lymphocytes are absent or simply in low levels. They may also be present but don't function properly. We could see both T and B cells affected, which could lead to a variety of recurrent infections. If there are genetic abnormalities in B cells, antibodies are affected, whether they're absent or reduced. Agammaglobulinemia involves an absence of antibodies, which is rare. Hypogammaglobulinemia involves a decreased amount of antibodies, which leads to recurrent bacterial infections, which can be treated with immune serum globulin. Lacking a specific antibody is common, with IgA being commonly absent. Without this antibody, an individual would suffer from infections caused by invasion of the mucous membranes. Defects in T cells can lead to opportunistic infections, cancer, and B cell deficiencies, because remember, the helper T cells are the basis of the immune system. DiGeorge syndrome involves the absence or immaturity of the thymus. Children become more resistant to certain infections, and attenuated vaccines may be a danger to them. SCIDS is the most serious of the immunodeficiencies. It involves both B and T cells, which put the patient at severe risk for infections. Genetic defects leads to low levels of lymphocytes. ADA deficiency is a situation where lymphocytes develop but are destroyed. Extreme aseptic techniques are required for SCID patients. David Vetter lived his life in a bubble in the 70s and 80s until he died at the age of 12. The only option for survival are stem cell grafts and gene therapy. Secondary immunodeficiencies can be caused by infections, metabolic disease, chemotherapy, and radiation. AIDS is the most commonly recognized and involves the destruction of helper T cells. Cancers affect both types of lymphocytes. Immunosuppressive drugs, which help to prevent graft reactions, also suppress activities of the immune system.